Hello, and welcome to a quick tour of both the program and the application process to the University of Saskatchewan College of Nursing Professional Practice Program. Perhaps you are here today because you have a specific question or two about the application process, the program itself, or maybe you are still trying to determine if the Master of Nursing Professional Practice Program is right for you. If you are looking for growth in your nursing career, as well as an opportunity to advance the nursing profession, then this is the program and opportunity for you. A student who completes our professional practice program will be able to demonstrate the kind of leadership skills needed to influence change, both in nursing and in the health of individuals and communities here at home and around the world. You can develop, implement, and evaluate strategies for advanced nursing practice at both the client and system levels. Completing this program gives you an opportunity to be able to articulate perspectives on nursing, to critique, utilize, and contribute to both the theoretical and empirical knowledge that is essential to advancing our profession. This is a course-based program. It's offered online using mostly asynchronous learning, meaning you don't have to come to class at a specific time or date or place. Instead, you can learn online at a pace that works for you. There is a graduate seminar in the first year that is synchronous and that gives you an opportunity to gather with your peers, do some learning, and build some community. This program is designed for students to complete in 2 years full-time or 3 years part-time. When you are a graduate from the Master of Nursing Professional Practice Program, you are able to take on new leadership and advanced practice roles in healthcare. Perhaps you can assume an educator role or in service at an educational institution. There is a whole host of opportunities related to research roles and really giving you an opportunity to learn how to generate and utilize nursing knowledge as a master's prepared nurse. And of course, you can use this degree to prepare for further study at the doctorate level. In this professional practice program, we ask our students to focus their studies either on education or leadership. Let's walk through what the program looks like. It requires 27 credit units of coursework. You start with a leadership course in nursing, then evidence-informed practice in nursing research course, philosophies and theories of nursing science to lay down some philosophical and theoretical foundations. Students also complete a statistics course. The program is capped off with the completion of Nursing 862 and Nursing 863, providing you with the opportunity to apply research to real-world practice, aiming for a useful knowledge translation product. There is a 3-credit unit, open elective, and 6 credit units of restricted electives. So essentially, you can pick 2 from this list. As you can see, you can learn more about teaching in nursing, Indigenous health policies, and you can really take some advanced learning, both in education and leadership, or do further work in research methods. There are many advantages to pursuing your master's degree at the University of Saskatchewan in the College of Nursing. First, our faculty and staff are positioned to collaborate with many other health science colleges here at the University of Saskatchewan, many of whom are housed in our beautiful health science building. These opportunities and partnerships allow us to really facilitate excellence in interdisciplinary health research, teaching, outreach, and community engagement. Doing a master's program with us gives you opportunities to explore and engage in research and scholarly activity shaping healthcare not just here in Saskatchewan, but in Canada and far beyond. There are excellent funding support systems, such as financial assistance programs, in addition to many opportunities for scholarships and bursaries. There's a slide at the end of this presentation that will show you opportunities that you can pursue for funding support through both the College of Nursing and the College of Graduate and Postdoctoral Studies. Our college is distinguished by our nation-leading integration of remote presence and other technologies supporting our Learn Where You Live philosophy and providing opportunities for this kind of personal and professional advancement in both teaching, research, and professional nursing practice. And we are experienced experts in teaching graduate programs online because we have been doing so by distance delivery since 2009. The tuition rates for the 2026-2027 academic year are as follows. Domestic students pay $1,054.50 per 3-credit unit course. So for the full program, you are looking at $9,490.50. International students pay $2,372.40 per 3-credit unit course. For the full program, that would be $21,351.60. The admission requirements for the Master of Nursing Professional Practice program include a 4-year bachelor degree in nursing, a 70% average over the last 2 years of study, or 60 credit units in an undergraduate program, current license as a registered nurse or registered psychiatric nurse, completion of 3 credit units in an undergraduate stats course, and an undergraduate research methods course. It is strongly encouraged that you have a 70% or greater in both of those courses. Some applicants may need to provide proof of English language proficiency. The application deadline for this program is February 3rd. The application is done online, and there is a required application fee. Once you've filled out the application form, you will be required to upload documents. The first document to upload will be a copy of your undergraduate degree certificate. No need to upload the original one. It can be a picture of the one that is hanging on your wall. If you are a graduate of the University of Saskatchewan, you do not need to upload this as we can access that information. You'll need to upload a preliminary statement of marks for all post-secondary institutions that you have ever attended. So that means even if you just took one course at another institution and transferred that course into your program, we still need that transcript for the one course. All preliminary statements of marks should include a grading scale. So if you have your transcript, it would be the back of your transcript. If the statement of grades you are submitting does not include the grading scale, you will need to contact the institution to get the grading scale to include with your online grades. 3 references are required. When you fill out the online application form, you'll enter contact information for your 3 references. You should choose referees who can attest to your ability to do well in a master's program. So someone who can attest to your ability to write in a master's program would be your best bet. Instructors you had in your undergraduate program who taught you theory courses will be ideal. When you enter the contact information for those references, the system will send them an email with a link to our reference form that they can fill out, and they may attach a letter to this form as well. Proof of registered nursing license is required. This document should include the date your license will expire, and it should show that you are currently licensed as of the day of uploading without restriction. All applicants who completed their undergraduate or graduate education at an institution outside of Canada or the United States, or completed their undergraduate or graduate education at an institution in Canada or the United States where English was not the exclusive language of instruction, must write an English proficiency exam. The following exams and scores will be accepted as proof of English proficiency. IELTS overall score of 7.0 with no individual score below 6.5. TOEFL overall score of 94 with minimum scores of 22 in reading, listening, and speaking, and a minimum score of 24 in writing. A statement of intent or letter of intent is required for every application. This must be no more than 3 pages in length. The goal of this letter is to give you an opportunity to submit a sample of your writing to help us better understand your interests, experiences, and ability to critically analyze an issue or area of research in nursing. APA style must be used for this document. Your document should cover the following: how completing a Master of Nursing professional practice degree at the University of Saskatchewan will advance your career goals, and why you have chosen to further your education at the University of Saskatchewan. What has your experience been in nursing practice, research, or teaching so far? You must include any publications, conference presentations, RA positions, involvement in leadership in nursing organizations, and Canadian Association of Schools of Nursing specialty certificates you have. You must also provide an area in nursing practice or an area of research you are interested in learning about. There must be a minimum of 5 scholarly references. Applicants are expected to create and submit their own original statement of intent. The use of artificial intelligence text generators is not permitted. The University of Saskatchewan has scholarships, bursaries, and awards that graduate students may apply to. The College of Nursing has a list of specific awards just for College of Nursing students, and the College of Graduate and Postdoctoral Studies has a list that all graduate students at the University of Saskatchewan will be eligible to apply to. For more information on the Master of Nursing Professional Practice program, please contact Jill Brown, the Graduate Program Coordinator, or Angela Ride, Graduate Program Advisor at nursing.advising@usask.ca.